Today, we're tackling cystic fibrosis, a major high-yield topic for LVNs studying for their NCLEX. If you remember only one concept about cystic fibrosis for your exam, make it this. Cystic fibrosis equals thick, tenacious mucus. It's an autosomal recessive genetic disorder. That means both biological parents must carry the gene for a child to inherit it. Because the body cannot properly move salt and water in and out of cells, body fluids become sticky and thick. Instead of acting as a lubricant, this mucus physically blocks passageways across multiple organ systems, primarily the lungs, pancreas, liver, and reproductive tract. Let's break this down system by system so you can score full points on test day. First, the gastrointestinal system. The very first sign of cystic fibrosis happens right at birth, and the NCLEX loves to test this. Meconium ileus. If a newborn does not pass stool in the first 24 to 48 hours and shows abdominal distension or vomiting, think cystic fibrosis immediately. As the child grows, blocked pancreatic ducts mean digestive enzymes cannot reach the intestines. This leads to three key findings. Number 1, steatorrhea, meaning stools that are large, frothy, bulky, greasy, and foul-smelling. Number 2, malabsorption. They cannot absorb fats or fat-soluble vitamins. Remember your vitamins A, D, E, and K. And number 3, failure to thrive. You'll see a child with thin arms and legs, but a distended abdomen. Next, the respiratory system. In the lungs, that thick mucus traps bacteria, leading to repeated chest infections like bronchitis and pneumonia. Early signs include wheezing, rhonchi, and a dry cough. Advanced signs include cyanosis, a barrel chest, and digital clubbing from chronic lack of oxygen. Now for 2 quick skin and reproductive facts. First, sweat contains excessively high sodium and chloride. Parents will often report that their baby tastes salty when kissed. Second, most biological males with cystic fibrosis are sterile because the vas deferens is blocked or missing. Keep in mind, sterile, not impotent. Biological females have thick cervical mucus that makes conceiving difficult. So, how do we definitively diagnose cystic fibrosis? The gold standard is the quantitative sweat chloride test. Pilocarpine is used to stimulate sweat, which is collected from 2 sites. Now, let's talk about nursing care and pharmacology. This is where the NCLEX will test your clinical judgment. For airway clearance therapy, schedule chest physiotherapy twice daily. Timing is everything here. Perform therapy before meals or at least 2 hours after meals. Never do it right after eating or your patient will vomit and risk aspiration. If using a flutter device or PEP mask, make sure it is kept away from toddlers because the steel ball inside is a choking hazard. When administering respiratory medications, order matters. First, give bronchodilators like albuterol to open the airways. Second, give a mucolytic like Dornase alpha. Third, perform chest physiotherapy. And fourth, finish with aerosolized antibiotics. For pancreatic enzymes, they must be taken with or within 30 minutes before every single meal and snack. Do not give them if the patient is NPO. Never crush or chew enteric-coated beads. You can open the capsule and sprinkle it on a small amount of acidic food, like applesauce. Always have the client rinse their mouth after taking enzymes sprinkled on food to prevent oral mucosal ulcers. You'll know the enzymes are working when the child has 2 to 3 formed stools per day instead of bulky, greasy ones. For dietary care, provide a high-calorie, high-protein diet supplemented with water-miscible vitamins A, D, E, and K. And always encourage extra salt in hot weather, during exercise, or when the child has a fever. That wraps up our fast facts on cystic fibrosis for the NCLEX. Keep pushing, study smart, and best of luck on your exam.